Hello, welcome again. I'm Dr. George Taylor, one of the physician scientists at Celeste Regenerative Therapeutics. We're the makers of AnteAge, a topical cosmeceutical for anti-aging skincare based on bone marrow mesenchymal stem cells. At this point, we've gone through a little bit about how cells communicate and how tissues respond to the bone marrow mesenchymal stem cells because they are basically the generals in charge of healing, and they do this through cytokines and growth factors that they secrete. I want to just briefly discuss the other kinds of cells that are used in topical products and sort of make a distinction between them. Fibroblasts are the oldest cells that are cultured for this type of use. That goes back close to 10, 15 years. And fibroblasts are obtained from, typically from neonatal foreskins from little circumcised boys. Other cells that have been used are fat stem cells that are obtained through liposuction waste. Something called parthenogenic stem cells. They're created by taking an unfertilized ova from an in vitro fertilization clinic and then chemically stimulating it to replicate over and over and over. We'll describe in a second why we don't think that's a great way to create a product for skincare. The interesting thing about the mesenchymal stem cells is not only how well they heal the body from the inside, it's the fact that you can grow them in the lab, take what they make in the lab, apply it to the skin, and you get the same sort of responses. Wounds grow in faster, heal faster. We think this is in large measure not only to the major pivotal role they play as the generals, the commanders-in-chief of healing, which is their natural physiologic role, but it's also because they shut down inflammation. They secrete a pattern of cytokines that is anti-inflammatory, and anti-inflammation is important. We want to settle down inflammation. Remember, that little fetal wound that we've discussed in other segments has no inflammatory phase and has no scarring. In adult skin, we're trying to reduce scarring, reduce pigment, reduce hypopigment, all as a result of shutting down the inflammatory phase, and the bone marrow mesenchymal stem cell is capable of doing that. Contrast that with the adipose stem cell. They produce a pro-inflammatory cytokine pattern. It's just what they make. And so the thought of putting that on the skin over and over and over, day after day, doesn't make a lot of sense if the objective is to settle inflammation down, to slow down the aging process. PRP fits in that category also. Profoundly pro-inflammatory. They have some good cytokines because they use it in treating bone fractures and tendon tears and all that sort of thing. But if you're going to put it on the skin, it doesn't make sense to inflame the skin more. Fibroblasts just aren't very good at producing cytokines. That's not their role physiologically. They don't do it very well. When you compare what they make compared to what bone marrow mesenchymal stem cells, it's 1/15th to 1/50th of the important cytokines. And so we think we've really dialed in on emulating and sort of replicating what nature does to make skin act and appear younger by it's the same effect as if you had more of these stem cells inside when you put them on your face. And lastly, I'll say that there's products out there, fibroblast-based product, as well as the parthenogenic stem cell based products, where they're basically rupturing or lysing or exploding the cells by freezing and thawing it till it ruptures, and using that as an ingredient, which for us doesn't make a lot of sense. You've got large molecules, you've got actually particles of peptides and cell remnants and all that sort of thing. And the penetration into the skin, we don't think is going to be very effective. So we've sort of covered what cells are out there being used. We think the heroes in this saga are the bone marrow mesenchymal stem cells. Thanks for watching. I invite you to visit us at AnteAge.com, visit us at barefacetruth.com, and I'll see you next time. Thank you.